The following program contains images of an actual surgical procedure. These images are graphic and may be disturbing. Parents are advised that these images may not be suitable for young children.
Today we're uncovering some of the most cutting-edge procedures you haven't heard about. Now you might think facelifts are nothing new, but how about having one while you're still awake? Take a look at this.
Are you ready for the big day?
I am.
Well, let's go get you marked.
I'm newly divorced. I'm 51 years old. I'm entering into the single world, and I need a fresher look.
Here is the amount of skin we're taking.
Wow.
We're going to get you a little sedation so you don't feel anything when we're injecting you. Just think how great you're going to look in a few days on the doctor. Here we're just going to cut right along the supratarsal crease. Taking some of this muscle here at the end tends to help a little bit with the crow's feet as well. Tony, how do you feel?
I feel good.
You're not feeling any of this, right?
No.
And this is very little fat we have to remove from the medial compartment. Taking too much fat out usually makes people look even older. Now we're closing the upper eyelid, and now we're giving her a little more sedation so we can inject the face.
So you've done my eyes?
We've already finished your eyes, and now we're doing the face part. Here's the flap. We've dissected it all the way into the neck. And now we're gonna bring up this layer, which is the SMAS layer. That's what's gonna give you the tightening. Already we're getting her a much nicer definition. Do you feel any pain at all?
Nope.
Okay, good. We're done with the neck. So we just sprayed the fibrin glue on, and the fibrin glue helps seal the space between the skin flap and the tissue underneath. It reduces some of the signs that we associate with healing, such as bruising, swelling, and discomfort. Very important closing. There you go. Now that she's more awake, you see how much better it is than before?
Like parentheses?
Right.
They're like gone, huh?
A lot of it is gone. You look a lot better, a lot younger, but you don't look like you've been through a wind tunnel.
Thank you so much.
You're welcome.
And Tony is here just 5 days after her surgery, along with her plastic surgeon, Dr. Nikolov, from right here in Beverly Hills. But before we see Tony's results, let's take a look at her before one more time. This is her from the front, just 5 days later. And at the same time, let's take a look at her side view, that profile view. We're going to have you turn towards your doctor, just like that. Remarkable, just 5 days after surgery. So what do you think?
It's amazing. It's amazing.
And how do
2
you
days
feel?
ago, I would have said, no way am I coming here.
And I'm seeing her pretty up close.
Right.
Very little bruising, obviously.
There was hardly any bruising.
She's
just a little
swollen. So Nick, tell me, what is different with this facelift, compared to the more classical facelift?
This is a procedure that I've been doing for the last 2 years. And it's a procedure that allows the patient to undergo surgery under local anesthesia if they so desire. And we all know there are lots of people that sort of have that phobia of going under general anesthesia, or maybe they have medical problems that
But a
don't
couple
allow
of
them.
things, Nick, that I think we need to make clear is that for the actual injection of the Novocaine, you did give her a little sedation, correct?
Yes, I did, and I wanted her to be comfortable, and it's important for the patient to have that comfort. Whether we give sedation or not, it's the patient's choice, but she felt okay with it, and we gave her just a little to take the edge off.
And I know you do a lot of facelifting just like I do. Doing it this way is not for everybody. There's some patients, because, did you hear anything or did you feel any pulling?
Very little pulling. I felt nothing. As long as he walked me through it and told me everything that he was going to be doing step by step, I knew I could stay calm.
You were aware that hands were touching you, for example, a little bit.
A little bit, but
Okay,
nothing uncomfortable.
So you had her just right.
Right.
And this was your choice, right?
Exactly.
I mean, you offered, do you want a deeper level of anesthesia, but this was her choice.
She felt very comfortable with the whole procedure, and the goal was to do what's comfortable for her.
What are the technical differences? I know you did face and eyes for her. Tell me a little bit about the incision, direction of pull, that kind of thing.
Well, the incisions, this is a much shorter incision, which of course gives us less scarring. For a more classical facelift, the incision would be right here. Then we will extend it down, and I usually go behind this little thing called the tragus. We will go around, and it's behind the ear. And of course, I'm doing this a little bit blindly. And then we're extending more in the area behind, which is called the occipital
Depending
area.
there, how much you want to get in
How
the
much
neck.
skin we want to take. In this facelift, and we'll try doing this in another color, the incision goes in the sideburn, and it's a little curved. And then we go in front, just the same. However, when we go around the earlobe, we stop just behind it. And in some patients, occasionally, you have to extend it a little bit further. But the goal is, as long as we don't cross that non-hair-bearing area behind the ear, that's where the scar shows a lot. And she wouldn't be able to wear her hair up if that were the case.
Right. Ultimately, when this heals, it's going to look great. I guess you have some pictures of some patients a little farther, post-op, before and afters you want to share with us. Let's take a look at those.
This is a patient that underwent the same procedure, and if you look at her, this is about 3.5 weeks after her surgery. And you see the swelling is gone, the jawline is nice and clean, the jowling is all gone, and she looks fresh, the neck is well defined, and she's had a nice result.
Nice results.
And most importantly, again, she doesn't have that pulled wind tunnel look that
at all.
looks like, guess who did my facelift?
Yep. I know you had some recent changes in your life, a divorce, so you're ready to get out there, right?
Yes.
Well, you look awesome.
Thank you.
Thanks for coming. Congratulations, Nick. Good work. Coming up, it's the leading killer of both men and women, and that's heart disease. But now